Thanks, JT and Leanne, for having me. I'm so excited today to share with you about our ambulatory prolonged video EEG. This is a modality that we have to help diagnose and treat patients with epilepsy and seizure disorders and other disorders, because very often with the monitoring we determine that it's not actually seizures or epilepsy and it might be something else such as a cardiac disorder. Here's our equipment that we send the patient home for several days, up to 3 days, where their brain waves can be monitored in an environment that's comfortable, an environment that's their natural environment at home and even work. And we see what their brain waves are doing for that time, and we analyze the data and determine if we see any abnormalities. Okay, for example, this is the machine that analyzes the data, that all the data is recorded on, that the patient takes home with them. And one of our lovely staff members and technicians would be placing the electrodes on the patient. And we would also be videoing the patient. The patient takes this little camera home with them, and they take it wherever they're going in their room, in different areas of their home, and they monitor themselves with this camera. This is the little device that we actually plug all the electrodes in that are on the patient's scalp that are monitoring the brain waves, and the patient carries it in this little pouch and straps it on them like a little purse or bag. And this is a modality that we have here in Montgomery that no one else is offering, and that quite often it takes 6 to 8 months to get a person in a university setting to have done. The great advantage of this modality is that patients don't have to go to a hospital setting and stay several days in a hospital where they're uncomfortable. They can go home, they take the equipment with them, and they're monitored in their own home environment and work environment. And it allows the patient to continue their activities of daily living while they're being monitored.